Now this tip is a big one. That's what she said. Anyway, this is tip number 8. We talk about INDs. And I love INDs. It's so satisfying to get some puzz out of it and get them feeling better, right? But there's a big difference between a simple IND, which gives an RVU of almost 3, and a complex or multiple IND, which actually gives you 5.2. That's more than a level 5 chart. That's huge. So what makes an IND complex or multiple? And again, I would document the word complex, IND performed, blah, 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 because then the coder has no option but to bill it as complex. So clearly, if you do more than one abscess, then it's multiple, making it complex. So make sure you document it as such. Don't leave it up to the coder. If you probe and break up loculations, and usually I put a Q-tip in there anyway, kind of move it around, right? But if you actually use forceps and break loculations, write that down. If you are packed after drainage or actually cultured, any of these 3 items makes this complex or multiple. Of course, multiple, you have to say that you did more than one. You get 5.2 RVUs, and I think that's huge and worth giving this a thumbs up right now. Charting should look like this. You only need 1 out of 5. The procedure, whether it's complex or simple, making 2 incisions, multiple abscesses were drained. Using forceps, the wound was probed and broken loculations. Wound was packed with whatever or drained place. Depth of the wound, sometimes if you use ultrasound guidance, that can give you more to the complex, and whether or not you culture the abscess. So if you do one of these documentation items, you get complex, and that's more than 5 RVUs. You're welcome.